second to get everyone in. All right, welcome everyone. Thank you for joining us for our COVID-19 media update. For today, our speakers include Rachel Severson, Immunization Section Data Analyst for CDPHE, Scott Bookman, COVID-19 Incident Commander, CDPHE, and Dr. Rachel Herlihy, State Epidemiologist for CDPHE. And I'm going to actually stop sharing my screen and take it over to Rachel to show you the dashboards.
Thanks, Heidi, and thanks everyone for your attention today. I'm going to go ahead and turn off my video before sharing my screen here. And I'm starting out from a blank web browser, and I'm going to start by traveling to covid19.colorado.gov. And I'm just going to briefly walk through our two main data dashboards that we have, vaccine data and infection data. So from covid19.colorado.gov, we have a few high-level cumulative numbers that are an overview of the situation in the state. And then I can click on Explore the Vaccine Data to go to our vaccine dashboard. And these Tableau dashboards do take a few moments to load when you're moving around to different sections. That's normal, and I'll also try and use that to slow myself down as I'm going through these. So at the top of the dashboard, we have some, again, high-level cumulative counts of people who have been immunized, at least one dose and fully immunized, and then how many doses have been distributed and administered in the state. And right now, these numbers reflect data that's been reported to CIS, our state immunization registry, and those don't currently include some federal doses that have been distributed and administered. And we're planning to update these numbers to include those federal doses soon. So from this high-level overview home page, I'm going to go over to the vaccine administration page, and I'll give it a moment to load here. So the first thing that pops up is cumulative distribution of all vaccines week over week, and that's based on what's been reported by the CDC. So for this presentation, I'm going to switch over to administration, and I'm going to switch our counts, or actually I'll stay on cumulative for now. So this is showing a daily time series of how many cumulative doses of COVID-19 vaccine have been administered in Colorado. And yeah, this just speaks to the amazing efforts that all of our partners have been doing in the past few months to vaccinate such a large amount of people in such a relatively short amount of time. So from these buttons, I can also click over to counts, and I can see a daily count of how many people received a dose on each day. Something to note about this data is that due to reporting delays based on vaccine administration data that public health receives, these counts for past days will fill in over time as we receive that data from vaccine providers. So next, I'm going to switch over to the demographics section of the dashboard. And these three graphs are showing on a state level the distribution of people who have received at least one dose, the various demographic categories that they fall into. So we have age, race and ethnicity, and sex. So for example, of the people who have received at least one dose, about 5% are in that 10 to 19-year-old age category. The gray bars on all of these graphs represent the corresponding proportion of Colorado's population that falls into that demographic category. And right now, those gray bars correspond to Colorado's total population, but we're planning to update our race ethnicity categories for Colorado's population to reflect the eligible Coloradans, which was 12 and up right now. So next, I'm going to go over to the last section, which is our county level data page. And I'll give it a moment to load. That was pretty fast, actually. So the first section that it lands on is the Oneplus vaccination rate. So for each county, it's showing the percent of the county's population, the county's eligible population, who has received at least one dose of COVID vaccine. And as more people get vaccinated, we expect this percent for all counties in Colorado to tick up over time. You can also click over to see the up-to-date vaccination rate, so people who've received at least one dose of J&J or their 2 doses of Pfizer or Moderna vaccine. And we can also click over to doses administered that's been adjusted by population, straight counts, and same things for doses distributed. So I am going to click over to doses administered, adjusted by each county's population. And from this view, either of those doses administered buttons, I can click on a county and see a summary of that adjusted administration rate. But I can also see, if I click, the corresponding demographic breakouts for people who have received at least one dose who live in that region. So for smaller counties, those are grouped together in regions to make a population of at least 100,000. But for larger counties, like Denver County, it shows those breakouts for just the county, since that county's population is higher than 100,000. So next, I'm gonna go back to covid19.colorado.gov and switch gears to our infection dashboard to briefly go through some of the data that's available there. So I'll click on Explore the Case Data from that main page. And while this main Tableau embedded dashboard is loading, I want to scroll down and point out an additional Tableau dashboard that we recently added, titled COVID-19 Variant Sentinel Surveillance. And this represents randomly sampled tests from geographically diverse labs across the state and shows the proportion of positives that were identified as each of these variants of public health concern. So this is meant to be representative of the proportion of variants that are in the state right now. And if you click on the blue info button on the top right here, there's a link that takes you to a CDC page with more information about each of those variants. So back up to the main infection dashboard. Again, similar to the vaccine dashboard, we have a high-level overview of cumulative counts of cases, hospitalizations, testing information, and deaths, as well as how many outbreaks have been detected in the state. And then also similar to the vaccine dashboard, a high-level overview of the current situation for cases, hospitalizations, emergency room visits, and testing. So I'm going to click first to the case summary page and give it a moment to load. So the first thing you see when you click to that case summary page is a daily time series of how many cases have been reported to public health per day. So whenever I look at cases over time, I like to look at a moving average. So I'll go to the 7-day average. And that just takes care of some of those spikes due to reporting delays and makes it easier to interpret an overall trend with what's going on with our reported cases in Colorado. I can also click over to the middle button here and look at deaths among cases. So this represents people who have passed away within 30 days of their positive COVID-19 test date. And it's a quick epidemiologic surveillance measure to help us get an idea of what's going on with deaths, COVID deaths in the state. So similarly, this is a time series over time since the beginning of the pandemic. And the same thing happens with case data, but also with deaths, there's a reporting lag that we see. So some deaths that might have occurred in the past few days, public health doesn't know about yet. And those counts for more recent days will fill in over time as we learn about those deaths. While I'm talking about COVID-19 deaths, so this is deaths among cases, We also have a section at the top far right called CDC Provisional Deaths, and these represent people who have passed away who have COVID-19 listed as a cause of death on their death certificate. So this has an even more pronounced lag because it takes time to go through those death records and make sure that they're being appropriately counted. And this is based on data published by the CDC, so we pull directly from their data to publish this on our website. So it's available in a few different breakouts. The first thing here is showing by age, and some of these younger age categories with low counts are suppressed. So that's something to keep in mind. If you were to add all of these up, it wouldn't necessarily match the total number of deaths that we're reporting. And you can also look at those deaths due to COVID-19 by week, as well as all these other categories. So next, I will go back over to the demographics page on our infection dashboard. So for both cases and deaths among cases, we can see cumulative distribution of which age categories those cases fell into, and also see that for sex breakouts and race and ethnicity categories. And you can also see a weekly percent of cases that fell into each of those age groups over time. So if you were to click around to these other buttons, you could see the same thing for other demographic variables and for deaths among cases. The last section that I want to highlight here is our hospital data section. So fourth button from the left, I'll click on hospital data. And I'll give it a second to load. So the first section that we land on is regional level, which shows, based on data that's reported from hospitals, the number of ICU beds and acute care beds that are available, as well as a 30-day look at how that is changing over time. I can click over to hospital level and see different breakouts based on data reporting for hospitals of people who have been hospitalized and are taking up COVID-19 related resources. So the first thing we see there is admission data. I can also click over to currently hospitalized to see the number of people currently hospitalized in Colorado hospitals because of COVID-19. And then the third section on here is patient level, which gives us more information about the actual people that have been hospitalized. So we see that broken out by cumulative categories and the percent of hospitalized patients that have fallen into each of those categories over time. So we have age, sex, race and ethnicity, as well as people's final path when they leave the hospital. One other thing I wanted to emphasize here is that on all of these dashboards, we have these blue info buttons at the top right. So if we click on any of these buttons, there is a brief description of the data that you're seeing on the corresponding page. And that's the case for both data that lives in the dashboard itself. So this is describing all of those metrics that are displayed below. And also there's a smaller info button that tells you information about these cumulative metrics on top. So there's one last thing that I wanted to emphasize, and that's if you scroll all the way to the bottom under this additional resources section, there's this link that says access the data files. So if I click on that link, it will take me to a Google Drive folder where every single day we publish in files all of the data that corresponds in the dashboard. So for example, for hospital data, if I open that up, I'm seeing a file for every single day that we've updated the dashboard. And if I can just see a preview here, it's a standardized CSV file with actual numbers corresponding to every single value that's in the corresponding dashboard. So this hopefully saves people from doing the frustrating and manual work of copying down numbers from the actual dashboard if you're trying to do something on a larger scale or over time. And with that, I will stop sharing my screen. That's all I wanted to go through. Thanks for your time.
Great, and then I will take back over the screen share and we'll go ahead and do questions. So for the Q&A portion of this, media Q&A portion of this, we'll use the raise hand function, and I'll go ahead and call on you if you could say which outlet you're with, as well as your name. And then we're also bringing in Scott Bookman and Dr. Rachel Herlihy to answer some questions as well. So let's go ahead and start with Meg.
Hello, this is Meg Wingeter from the Denver Post. You had said about that you'd be updating the race and ethnicity data to reflect the eligible population. Do you know when that's going to change? And also, are you planning to publish any more data on breakthrough cases? We're getting a lot of questions from the public about that.
Can talk about the population adjustment. We're planning to do that sometime early next week, I think, and I think we'll put out a press release with more specific information about that change.
Thank you.
And this is Rachel. I can address the vaccine breakthrough data. So I think the first thing that we are doing is working with our local public health partners to give them better access to their regional or local data when it comes to breakthrough cases. So that's actually something that's ongoing right now. We're working on making that data readily available to them. In some cases, it ends up being small numbers in our smaller counties, and so numbers have to be interpreted carefully. So we are working on all of that, and I think probably after we get through that phase, we would look to making more of that data publicly available.
Thank you.
Great, thank you. Seth, we'll go to you.
Hi, thanks. Seth with the Gazette. A little off topic from data and probably for Scott and Dr. Herlihy. Can you guys talk about efforts the state is making to give resources, give support to those counties who are kind of particularly far behind some of the leaders or the middle of the pack as far as vax rates go? Thank you.
Scott, I can address that. Obviously, getting our vaccination efforts, our vaccination rates up across the state is our top priority. These vaccines are safe, they are effective, and they are the key to ending this pandemic. Our team is working closely with local public health, with community-based organizations, with healthcare providers. We're doing an aggressive media campaign, really doing all that we can to ensure that people who want to get this vaccine have the access to it, and that they can get their questions answered about safety and efficacy, so that we can continue to see our rates increase and put this pandemic behind us.
Great, thank you. John Ingold.
Yeah, thanks. It's John Ingold from the Colorado Sun. I have a question on the county level vaccination data for the one dose rates of the eligible population. Some of those counties that are at the very bottom have large prisons there, so they have large populations of people who are incarcerated. And I'm wondering if those incarcerated individuals are counted both on the side of the vaccinated population within those counties, and then also on the eligible population side.
I can speak to that a little bit. We source our population data from the state demographer's office, and they do include incarcerated individuals in those county totals. So those individuals are included in the eligible population denominator. We are receiving vaccine administration data from state prisons, and we're still working with the Bureau of Federal Prisons to get that federal administration data from them. And we're also in communication with those counties with large prisons to try and figure out how we can better estimate more accurate rates for those. But yeah, that is definitely a surveillance data challenge, that we are not receiving all of those federally administered doses in federal prisons.
For those counties in the state prisons, do you feel like you're counting all of those where they should be counted? I guess I'm just kind of wondering how much do we interpret that those counties actually have low rates versus how much of that is a data issue?
It is somewhat a data issue. Often with incarcerated individuals who may move around a lot, they may have their county of residence recorded in our registry instead of the county where they're currently incarcerated. So that is an issue, and I think we looked into it specifically with one county and found that it might be affecting their rates by maybe 2 or 3%. So not a significant change in what we would show for their up-to-date rates if all of those individuals were being counted in the county where they're currently living in that state prison. But definitely something where there is a little more, the uncertainty bars are a little higher on those counties compared to some other ones without those large prison populations.
And do you know which county that was?
Fremont County.
Okay, thank you.
All right, Taylor. Taylor, do we have you?
Yes. Hi. Sorry, my microphone was off. Taylor
No worries.
Summers for NBC News Radio in Colorado. I was reading something about a few states looking at a possible mobile platform where people can have their just immunization records on hand, show off anytime, not just for COVID-19 vaccines, but for everything. I was curious if Colorado had looked into potentially adopting something similar where like a one-stop shop for all immunization records.
Yes, we are currently looking into what a customer-facing portal for our immunization registry would look like, and we should have more information for the public in the coming weeks.
Would you be able to tell us like any name of that portal you're looking at?
I can't speak to that right now. Our team is looking into all the best options, and we'll choose one and come forward with that when we're ready. But they're actively looking into it. We know it is important for people to have access to these records. We want to make it easy for everybody to show proof of their vaccination. So we are actively looking into it.
Great, thank you. John Daly, you're next.
Hi, John Daly, Colorado Public Radio. Thanks for taking our questions today. I think there's a question for Dr. Herlihy. I was just looking at that graph with the variants of concern, and it seems like it was a few weeks ago now that we moved past the point where the variants of concern or the UK variant was dominant in Colorado, so more than 50%. Do you have an estimate of what percentage of all the cases in Colorado are now variants of concern, and what are the implications of that going forward in terms of the pandemic and how this might play out with vaccinations and all that stuff?
Yeah, good question. So if you look at that dashboard, we are now estimating that more than 70% of our positive cases in Colorado are due to variants of concern, with the vast majority of those being the UK or B117 variant. So we are tracking all of those closely. That's obviously a concern of ours. I think the good news is that we know that the vaccine is effective against all of the variants that are circulating, including all of these variants of concern. At this point, we have not identified in the US or outside of the US any of these variants of high consequence, as CDC calls them, where we would see potential significant impact to vaccine effectiveness. So I think that's the good news. But we do believe that many of these variants that are circulating are probably more transmissible and more easily spread from person to person. And that could be one of the concerns and one of the challenges that we're facing now and probably will continue to face.
Do you mind if I ask a follow-up, which is the risk going forward kind of what we've been seeing in Mesa County here in the last week or two, where a variant is taking off in an area where the vaccination numbers are lower, and that might prove challenging in areas like that, going ahead the next few weeks and months?
Yes, so we are certainly seeing that now, and I think we will continue to see that communities in Colorado where we see the highest infection rates are going to be the communities where we see the lowest vaccination rates. We see a very strong correlation between those two factors, and I imagine that is going to be the case moving forward. At some point, it might be sub-county level, and we see this really with all vaccine preventable diseases, where we might have a vaccination level in the state of 95%, but there are always going to be these pockets of under vaccination. And those are going to continue to be the communities that are most at risk, whether that's a county, a town, a school, a play group, whatever it might be. Those groups where the vaccination rates are lower are going to be the groups where the risk of transmission continues to be high.
Great, thank you. And I'm actually going to stop sharing, and Rachel's going to share one more time to show you just a few more things on the dashboard.
Thanks, Heidi. Sorry, I meant to show this earlier. We also have Spanish COVID19.colorado.gov website, and same layout, corresponding Spanish vaccination dashboard and Spanish infection dashboard. So we are really proud of this, making the data a lot more accessible to a lot more Coloradans. And yeah, just want to emphasize that this resource is here. Thanks, Heidi.
Yeah, thank you. And so with that, do we have any other last questions? Meg, go ahead.
Thank you. And so you had mentioned about setting up a public-facing portal just for your vaccination records. Just to be clear, this doesn't sound like it's any kind of passport system, just if you need your records for school or whatever it may be, that you have easier access to them. But am I understanding that right?
Yes, this entire thing that we are discussing is simply to ensure that people have easy electronic access to their vaccine records, not just for COVID, but for all of their immunization records. It's the right time to make this easier for people to access and display.
Thank you.
Great. Well, I think with that, I have one more. Rachel, go ahead.
Hi, sorry. I'm Rachel Estabrook from Colorado Public Radio. I'm wondering if you all have thought about 24/7 vaccine clinics, with so much of the research saying that some people just can't find the time to get vaccinated. Is that something you've considered? And I'm wondering why it hasn't been pursued.
This is Scott. So we are continuing to evaluate whether adding off hours at our clinics will increase vaccine access. We're looking at this for our mobile clinics, for our pop-up sites, encouraging our providers to also provide off hours to ensure that we make this vaccine as easy and as accessible for all. We did an event during the week down at Trax Nightclub in Denver, and that event went until 11 p.m. So we are really doing all that we can to meet people where they are and provide access to this vaccine in the best way possible.
Great, thank you. And with that, I think we're going to go ahead and close for today. So I want to thank our participants, as well as our interpreters, and of course all of you for joining us. And I hope you have a great rest of your day. If we did not get to your question, or you think of a question later, please send that over to media_info@state.co.us, and have a nice weekend.